Hey, good morning, everyone, and welcome to the UroPatient podcast. I'm your host, Vic Senese. Glad to have you here today. If you're watching us live, you're watching us on YouTube, LinkedIn, Facebook Live, X, or Kick. Welcome to the show. We come there all the time. Hey, for those YouTubers out there, be sure to hit that like button. It really helps our numbers go up better. So numbers are good. This is your first time joining us, go to UroPatient.com, the best place to catch all of our past episodes, learn more about the website, and find all sorts of stuff. We got a bunch of past episodes up there for you, so be sure to check those out. Also, we have a whole bunch of these nice, helpful handouts on our website. Download them, bring them to your doctor's appointment. They're perfect for that. So this week, I'm joined by one of our other podcasts. Dr. Jeff talks about sex and intimacy. I have the host of that, Dr. Jeff, joining us. His website's drjeffsextalk.com. It's every Tuesday at 7 p.m. So let me tell you a little bit about Dr. Jeff. He's a board-certified advanced practice urology clinical nurse specialist, nationally recognized researcher, and author based in Chicago. With over 30 years of experience caring for individuals with sexual dysfunction, Dr. Albaugh has dedicated his career to improving the sexual and emotional well-being of patients facing urologic and pelvic health challenges. He is the host of Dr. Jeff Talks About Sex and Intimacy, where he brings thoughtful, evidence-based conversations to light, helping individuals and couples navigate complex topics with compassion, honesty, and hope. Let's bring in Dr. Jeff.
So what can we do about erectile dysfunction? Well, first off, we can talk about it. You can do counseling, we can do behavioral therapies. Now, that's not going to correct or fix it or give you a way of having better erections, but sometimes it will help, because once you start worrying about erections, anxiety is adrenaline's part of fight or flight, and it will make your erections go away. So you want to stay focused on sex, and not become anxious. You are having sex. This is not the time to have anxiety or worry. But when you've had previous problems, you do worry and become anxious. But you have to keep refocusing your mind on sex, because anxiety is adrenaline's part of fight or flight, and it will make your erections go away. So that's important. And so we always try to address that, because even though there's a physiologic thing going on, it can definitely mess with your mind and make you anxious. And so we work on that as well. There's a vacuum device, which we're going to talk about. There are pharmacological agents, which we're going to discuss, and there is surgery. So what is penile rehabilitation after prostate treatment? It's just the use of these interventions that we're going to talk about. By themselves or in combination, they are used with a goal of preserving your precancer treatment erectile function, trying to get you back to where you were before you had your surgery or radiation. The goal is to preserve penile function by increasing blood flow to the penis. We try to promote smooth muscle relaxation and vasodilatation, which allows the blood to fill the penis and make you hard. So that's what you're trying to promote, is that activity that has happened from the day you were born till it stops working right, mostly during sleep, or if you're excited, or during stimulation. Any changes in blood flow to the penis may facilitate improved health of the tissue within the penis. The more that happens, the better. So therefore, preventing this may prevent further damage to the penis in terms of atrophy, which is shrinkage or scarring. Consistent treatment is very important, and doing something that actually causes changes in the penis. You know what changes in the penis are. Your penis becomes fuller, thicker, harder. It moves from that very flaccid state to more, right? And so that's what we're looking for, because when it moves, that means muscles are moving and blood is flowing, and that's important. So what do we have? We have oral agents. Now, oral agents rely on nervous conduction, communication between your brain and penis, and blood flow. So they may or may not work very well after your surgery, especially in the initial phases when the nerves are traumatized and not much is happening down there it also may not do much with the pill. But remember, as the nerves and blood vessels and things are recovering, regenerating, doing what they do after surgery, remember that can take up to 5 years, average of 2 years. But as that's happening, and it usually happens progressively, slowly, sometimes painstakingly slowly over time. But as that happens, you may respond differently at each of those junctures to the pills. So try them, even if they didn't work at all in the beginning. Certainly keep trying them as you see more activity in your penis, because you may respond better as you move along. They do rely on nervous conduction between your brain and penis and blood flow. So especially in the beginning stages after surgery, they may not work. And they may not work eventually either because of those reasons. But depending on how much recovery you're getting, they may start working at any of those junctures at various doses. Most people find that after surgery, they have to work their way towards the highest dose. But as you recover, you may be able to lower those doses and respond. So it just depends on every person's different and how you respond. It's a very individual response that each person experiences after surgery. But we have sildenafil, which is Viagra. We have vardenafil. It used to be called Levitra, but Levitra is not available anymore. But vardenafil is still available, the generic version of it. Tadalafil is Cialis, and it can be taken daily or it can be taken on demand. Avanafil is Stendra. It gets in twice as fast as the top three that I just talked about, sildenafil, vardenafil, and tadalafil. So it gets in quicker, but it gets out quicker. Cialis lingers the longer. Tadalafil lingers the longest. Sildenafil and vardenafil are probably in your body a total of about 8 to 12 hours. And then tadalafil's in there for up to 36 hours. Avanafil's usually out within a couple hours. The first three get in about 30 to 60 minutes, but they don't peak usually for about an hour to an hour and a half. Avanafil can get in about 15 to 20 minutes and peak in about 30 minutes. And so just remember that. Sildenafil especially needs to be taken on an empty stomach because it's more sensitive to food and fat. But a heavy meal, especially a heavy fat meal, may inhibit some absorption with these medicines, but especially it will inhibit sildenafil. So all of these drugs work similarly, and they usually work just as effectively as the others because they all work the same way. They're just slightly chemically different. But these medicines can be used. Typically for penile rehab, they're used on a daily basis at the higher doses. Like, for example, the meta-analysis said sildenafil should be 100 milligrams every day would be the best strategy for penile rehab if you're able to tolerate that and that's going okay and you're working with a provider. That's what the latest evidence says. And then if you're using the other medicines, typically they're used at the higher doses and they're used daily. It just depends. Some people just use 5 milligrams of tadalafil daily. Some people use more. Remember, you don't exceed 20 milligrams in any 24-hour period on that drug. You don't exceed the maximum dose of sildenafil in any 24-hour period, which is 100 milligrams, and vardenafil 20 milligrams in any 24-hour period. Those would be the maximum doses that you would use daily. And so lots of things to think about. You should be working with a provider on this. Someone's prescribing it and working with you directly. It's a prescription and you need to work with them. How do you respond? Do you have side effects? That's really important. Or if you're able to tolerate it well, then you can use this for both erections and rehabilitation to help you move along. Because if you're taking the drug and you're seeing more muscle activity and blood flow, which means changes in your penis with the drug versus without it, with stimulation and sexual thoughts or when you're sleeping, if you're seeing more happen with it, now you know you're a responder. More blood flow, more muscle activity is occurring when you take it, when you don't. And that's where it may benefit you because the more muscle activity and blood flow that occurs, the better. And that's why, especially when you're not getting night erections, you want to get that penis moving. You don't want to climax because then it won't move anymore, but you want to get it moving regularly. Get it moving a little bit. It does what it does. Don't judge it. Go on with your shower or your privacy in the bathroom. Let it settle down. Get it to move again. You're kind of simulating what used to happen while you slept, just trying to get it to move. Try not to judge it. Just see if you can get it to move a little more, because every time it moves, muscle activity is occurring, blood is occurring in your penis. So along with the pills, you don't want to just take the pill and hope it works. You want to think sexual thoughts an hour or two later after the top 3 ones, and which is sildenafil, vardenafil, tadalafil. They're not the top drugs, but they're listed in those orders. And so you want to take those about an hour ahead of time. Then you want to have sexual thoughts and stimulation to see how much they're helping you and what they're doing to get the maximum benefit out of them. You don't necessarily want to climax because then it won't move anymore, but get that movement to occur, because whatever your penis does, if the muscles are moving, the blood's flowing, that's like physical therapy for your penis. And so, but again, the pills don't always work, especially right after surgery. Don't get frustrated and don't give up on them, because they may start working. As you start recovering more function, the pills may start working better. Lots to say about the pills, but I'm going to move on to the vacuum pump. The latest research says that if the pills aren't doing enough, then you should probably use something along with it, and that something is usually the vacuum pump, because it's non-invasive and if you use it carefully and according to good instruction from a provider and the instructions that are included with it, it may help you with erectile function and having sex, as well as penile rehab. So if the penis isn't moving much with the pills, or even enough with the pills, you can also do some stretching inside the vacuum constriction device, which is what is shown here. Now, the vacuum constriction device, there's lots of great devices out there. This is the Rec-Aid, the Post-Evac. There's lots of good devices out there. So the Encore, I've used all those devices, and they're all good medical grade devices. You need to work with the clinician to find the right device for you, as well as also on one-on-one instruction, which is very important to success. But you can, let's say that you get a partial erection from the pill. Now you can put it in the vacuum pump with that partial erection and bring it up the rest of the way. You're not overstretching it, but bring it up till you have a painless, even lifted off erection within the pump, and then let it sit in there for a minute or two, and then take it all the way out. It won't even go all the way down. Put it back in and bring it up again till you have a painless, even lifted off erection inside the pump. Take it out, put it back in. There's lots of different strategies and ways to do it, but the research showed doing about 5 to 10 of those penis push-ups, those stretches, holding them each a minute or two, may help with the blood flow and the nervous, with the blood flow there. And so in addition to using the pills, you can use this together with it. Some of the latest research shows that using the pills, and when the pills aren't doing enough, the vacuum pump along with it, and the pelvic floor exercises, that triad of 3 things seems to be a pretty good strategy for penile rehab. We still don't know the absolute definitive best strategy, but that's one of the strategies that has been shown in research that may be helpful. I wish it was much more helpful. Then I tell you, everybody should do it. It's the most important thing in the world. Some people respond, some people don't respond to penile rehab, especially with the pills. And that's where, if the pills aren't doing enough, you probably need to move on to the vacuum pump. Or you can leave the vacuum pump and the pills behind, and you can do injections instead. And we'll talk about those in a minute, because that's another strategy. And again, we don't know the definitive best strategy, but if what you are willing to use, and most people are willing to use the pills, and you're doing pelvic floor exercises, so do those, because it brings blood down to the area. But you do the pelvic floor exercises, and lastly, do so pills, pelvic floor exercises, and the vacuum pump. Yes. And so they're asking, do injections hurt? And we'll get to that when we talk about injections in just a minute. But that's a good question, and we will talk about it. And I actually did one of the studies that said, no, injections don't hurt. I did a study where we had men rate pain right after they stuck themselves with a needle. And most men say that it doesn't hurt. Good question, though. So again, so one strategy is use the pills. If the pills aren't doing enough, of course, you should be doing your pelvic floor exercise, whether the pills are working or not, to help. That helps with continence, but it also tangentially, not directly, may help with erections. And then lastly, you have the vacuum pump. So, because if the pills aren't doing enough, adding the vacuum pump, it has been shown that that's a more effective strategy. Using them together is more effective than just using the pills when they're not doing quite enough, or just using the pump. If the pills help some, use the pill and the pump and the pelvic floor exercises. Okay, so what about injections? This is just a scary thought for some men. But when we did our study, right after the man put the needle in, with our study, we asked them, rate the pain 0 to 10. The average pain rating was about 1 to 2, and 40% of the men said it didn't hurt. They rated it 0. That's surprising, but true. Other studies have also shown that the average pain rating for a needle stick is about 2 out of 10. So again, most men don't find it painful because it's a very small diabetic needle. Some men are still very bothered by using a needle on their penis, and I get that, and that's okay. No treatment is for everyone, and injections may not be for you. So I would say it's a very personal decision, but you can use injections up to 3 times a week, once in 24 hours. You will definitely learn to do this under supervision. You should do your very first injection in the office with a healthcare professional who knows exactly what they're doing, so you can make sure you know how to do it exactly. You and your partner, if you have a partner, feel comfortable doing it, and to see if you have any side effects or problems. Now, in terms of pain, the number one side effect, not from the needle, but as the drug kicks in, especially alprostadil in particular, prostaglandin E1, which is the FDA-approved drug, and is also in Trimix, that particular drug can cause an achy pain. The drug does well with causing smooth muscle relaxation and blood filling your penis for most men, but it can cause pain in about a third of men. 2/3 don't get it, a third do get it. Bleeding and bruising, of course, because you're sticking a needle in a vascular area. But you also run the risk of getting permanent scarring. Only about up to 10 to 15% will get that, or a priapism, which is an erection that won't go away. So there are very important things you need to go through when you're doing injections. It's not like swallowing a pill. And as we get more invasive, there's more risks and more side effects. And you need to understand those if you're going to do injections, and do them under good guidance and care from a provider and nurses who teach you how to do all this. It's really, really important for safety and efficacy to do that. But again, the vacuum pump works in about 80 to 90%. It's physics. It forces more blood in the penis. And then if you want to have sex, you put a ring on to hold it. It's not perfect, but it's non-invasive, and it works in about 90%. This also works in about 70 to 85, sometimes up to 90% of patients in some studies. So it has a pretty good track record, but it is more invasive, but you don't have to wear a ring. Good and bad with each treatment. If you want to have sex with the vacuum pump, you do have to use a ring. When you're rehabbing, you don't use a ring. You're just stretching. But with this, you don't have to wear a ring. Some men feel they get a little bit more natural feeling and look erection because they don't have to wear a ring, and you don't have to use all that lubricant if you don't want, and stuff like that. So injections, good and bad with everything. But there are studies that show doing injections regularly, and especially in that first period after you've had your surgery, when you most dramatically notice the problems, doing pills, vacuum pump, injection, pelvic floor exercises, some of these things may help you better preserve erectile function. I wish it always helped. Sometimes it helps, sometimes it doesn't. How do you know if pills are helping? Are you a responder? If nothing happens when you take the pill, then they're probably not helping very much in terms of penile rehab. If you get responses when you take the pill, and the more response, the better, the more that happens, the more those pills may be helping you. If they're not doing enough, maybe you need to move on to injections. We don't do pills within 24 to 36 hours of injections ever because of the risk of priapism. So injections, but not within 24 to 36 hours of the pills. But you can do the pills with the vacuum pump. And of course, you can do your pelvic floor exercises. So then there's another newer drug I just wanted to mention called Eroxin. It's over the counter, but it's FDA approved. And what happens when you work it into the penis, it causes a cooling effect on the skin, which brings blood in and causes a little bit more erectile function. We don't know, because there's not good studies with men after prostate surgery, if it will work for them. But in men with erectile dysfunction, 60% had an erection within 10 minutes and 60% had a minimally clinically important difference in their scores with their erectile function. So is it going to be the be all end all for men after surgery? I don't think so at all, but it's another thing to think about. It's over the counter. You don't need a prescription for it. And it might be something that you might be able to try. You can see it doesn't have the efficacy of pills, the vacuum pump, or the shots, but it is a newer treatment, and I wanted to mention it. Also, there is surgery. When all else fails, there's a penile implant surgery where they literally put cylinders in your penis, a pump in your scrotum, and a reservoir in your abdomen. When you pump the pump in your scrotum, the chambers fill in your penis and you get hard. When you hit the release, the fluid goes out of the penis chambers back into the resting chamber. It is permanent, but it works. And even though only about 1 to 3% of men will go on to do something as invasive and permanent as a surgery, 80 to 90% of those men are very happy with that treatment. And so it's not for everybody, and it is permanent. If you want to learn more about it, we did a podcast on it on Dr. Jeff Talks About Sex and Intimacy, and we talked about the good, bad. It's also in the book. I tried to lay out the positives and negatives in the book that you can download for free. You can get a hard copy of it. It's like $20, but you don't have to do that. You can download it for free and learn the good, bad, and ugly of all these treatments. One thing is you'll see in the book about MUSE, medicated urethral suppositories for erections. That is no longer available. It's an intraurethral suppository. So just forget about that chapter because that's not available anymore. It went on back order and it's not available. So what are the recommendations in terms of penile rehab? And so first off is to discuss penile rehab, to start early with it and discuss that erectile dysfunction is going to, in all likelihood, it will happen after prostate cancer surgery, especially radical prostatectomy. And that validated instruments should be used, like you heard me mention the International Index of Erectile Function, and things like that help us measure erectile function and quantify it and can be very helpful. Recovery can take up to 5 years, an average of 2 years. So reminding men about that, reminding you about that is really important. There's conflicting data on how well oral agents work. Viagra, levetiracetam, stendrastatin. These drugs, remember, some people are responders after surgery, especially right after surgery. Some people take time to become responders. Some people don't respond well to them. So how well they're going to work for rehab is dependent on how well you respond. Nobody else but you. The data is inadequate to say this is the absolute definitive way to do it. But some studies show, like this study showed, this is a study that showed from the evidence in current literature, and this is from a while back, you can see from 2012. But at that point, and since then, I'll tell you what's been shown. Some evidence says that using the pills, the pelvic floor exercises, and the vacuum pump is your best strategy. Now, since then, too, I've seen other studies that shows using maximal doses of your PD5 inhibitor, that's your sildenafil, vardenafil, tadalafil, avanafil, using maximum doses of those and using those regularly along with the vacuum pump to do some stretching and the pelvic floor exercises. Now, this was from a single institution, so keep that in mind. And remember, we wish this worked better, but 68.2% in this study, that's only 73 men, so keep that in mind, that combination of the pills and the vacuum pump had the best recovery. So again, we don't have all the research we want, but research costs a lot of money and it's difficult to get done. So we don't always get the answers as definitively as we'd like. But some strategies say this is a good strategy. Other strategies say doing injections is a good strategy. And when you're not injecting, not within 24 to 36 hours, some men will do the pills and the vacuum pump as well. That can be expensive, but there are different things that may help. And we wish they helped even more than they do, but we're glad that they can help men move along in some cases. So here's some resources. There's my podcast, which will give you a lot of information. Again, Vic and I get these podcasts are just a labor of love. We do them just to help you to have the information you need. The American Cancer Society and also the NCCN, the National Cancer Care Network, have some great information, especially on sexual health. There's some videos at North Shore. I have a video library created for men and women, but again, the podcast is even more up-to-date things. Cancer.org, which is the American Cancer Society. The Sexual Medicine Society has the Sexual Health Matters. Lots of good resources for you that I hope help you, give you the information that you so desperately need to help you move forward in healing, if that's what you want. Basically, we just wanted to make sure you know you are not alone, that if you're having sexual dysfunction in terms of erections, changes in climax or orgasm, or penile shrinkage, or whatever the issues are, that you are not alone. Most men are struggling with these things after prostate cancer surgery. There are treatments, and most importantly, there is hope. Communication's important. Make sure your partner is included on these meetings with your provider when you're addressing sexual issues. Make sure you're talking about sex with your partner and that you're working on things together. That can be incredibly important. And lastly, it is totally possible to have a wonderful, fulfilling sex life after prostate cancer treatment with surgery, radiation, whatever you do. There's non-penetrative outer course type things you can do. Then you don't need a hard erection. There's things that can help you have a hard enough erection to do other things like intercourse and penetrative sex with partners or a partner. There is hope. And so, but we wanted to tell you the truth about it. Most men struggle, and you're not alone. There is treatment, there is rehab, and ultimately, what is that journey for you?
Yeah. Well, Jeff, this has been really great having you on the show today. It's a lot of great information for patients. Most important thing out there is don't forget there's options. Don't just give up. And catch us again next week for more on UroPatient.com.